Straight.
There we go, right there. Make it level. There we go. There we go. All right, pull it up on your phone.
It says it's waiting.
Does it say we're live when you look on the front?
Live, yes.
Okay. So if you can hear me, put a note in the comments that you can hear me and see me. And let me know how the picture looks. I have Melinda here with me. She's handling the camera and everything. And as you see, we're driving. And I'll give it a minute and we'll get started. How's the picture look? Yep, it looks good. So we are on our way to LSU to pick up Woody. He colicked, and I'm going to go over exactly what happened, how everything was handled. He's doing fine. We're actually on our way to go pick him up, and I'll tell you all about it. And I want to talk just kind of about colic in general and some of the signs of colic and symptoms and how to handle it, and just answer any questions that you have about colic, and be better prepared so that, or be prepared so that if your horse is colic, you'll know what to do, be prepared for it. And a big reason why we had a good outcome with Woody is because I saw the symptoms early, I caught it early and acted on it quick, and it had a good outcome. Is it broadcasting?
Yeah, I think so.
You got a...
I can hear you, yeah. I think
Okay.
it's doing good.
Any viewers yet?
One like, I don't see.
Okay.
20 watching, so yes.
Okay, great. So we do have a few people watching. If you have any comments, put them in the comments. I have Melinda here. She's going to read the comments to me, and this way I can concentrate on driving. So on Monday, we had pretty bad weather Monday morning. Rode Monday morning, went to lunch, and when I came back from lunch, Woody was, I believe, the first horse that I rode in the covered arena because the weather was bad, real bad. Really an easy ride. I mainly just worked on trotting and steering, just getting him soft and asking him to bridle up. It was really pretty easy ride. I didn't ask a whole lot of him, and got him, I don't know, 40 minutes maybe that I was on him. Got done, unsaddled him, rinsed him off. He really wasn't that sweaty, but I rinse everybody after I ride them this time of the year. Rinsed him off, put him back in the stall, and went on riding my next horse. And a little while later, maybe an hour and a half later, I'd ridden another horse and I was walking past Woody's stall, and I saw him in a stall just kind of up and down. And you know how a horse will, when they're wet and itchy, they'll get up and down and roll a lot, and that's kind of what it looked like. But I stood there and watched him for a minute, and I realized that it was more than that he was uncomfortable. And at that point, I took him out of his stall and put him in a turnout pen outside, and that way he had more room to move around. Give him a chance to move around and see if it worked out. So I put him outside. He was outside for 30 minutes or so, something like that. And I noticed that it wasn't getting any better. So I called the vet, talked to the vet, and at that point I gave him Banamine as per the vet, and gave him probably another hour after that, and there still wasn't any improvement. During this whole process, I'm watching his behavior, and I'm watching his breath rate and his heart rate. And typically a horse's heart rate is around 40 beats a minute, and the breath rate is around 20 beats a minute for a horse in rest. And his was slightly elevated, but it wasn't much. He wasn't sweating. He really wasn't, none of his vitals or anything was really showing much signs of distress. It was mainly just up and down and acting uncomfortable. So I call a vet. He said to go ahead and give him the Banamine, which I did. And about an hour later, it wasn't any better. So I had the vet come out and take a look at him, and just watching traffic. I had the vet come out and take a look at him. He did give him a little bit of oil, not a whole lot. He saw basically the same thing I saw. He was pretty hard on his left flank, so we was pretty confident that it was a gas colic at that point. And this whole time I've been walking him, moving him, and normally with the gas colic, if you give him a little bit of Banamine, relax the muscles, and keep them moving, most of the time it'll go ahead and pass through and they'll be okay. But it just wasn't passing. And at one point, when the vet was there, Woody laid down. He wasn't really thrashing, so we were letting him try to get comfortable. A lot of times when they're up and down,
I think we're in a spot where it's not receiving.
Okay.
I just lost it on my end.
Hopefully it comes back. A lot of times when it's gas and they're up and down, they'll move past the gas through. So since he wasn't thrashing around, we wasn't really worried about twisting the gut. We was letting him lay down and get up to a point. And at one point he'd lay down and just stayed laying down and relaxed. His breath rate was slow and stayed laying there for probably 20 minutes. Then he got up and started moving around. But we went on and I was able to contact the owner, and we went on and made the decision to bring him to LSU vet school. That is the closest vet school to me. It's roughly 2.5 hours, 2 hours, 45 minutes. Went on and brought him over here, and we got him here probably somewhere around 11 o'clock Monday night. And they ultrasounded him. The ultrasound was good. Checked him for sand, that was good. Did a belly puncture, that was good. Basically, all the tests that they ran matched the vitals that I saw, that really showed that there was no reason for a problem, but he was obviously showing that he was in pain. And basically, they watched him and observed him, and eventually he passed gas, and he's fine now. We're on our way to go pick him up. And basically what the conclusion that I've come up with, and I've talked to the owners also, that he basically is just kind of a wimp about pain. And I'm sure he was really hurting, but a more stoic horse may not have shown it at all, or wouldn't have shown it very much. And that's where you get into trouble with colic. He showed us right away that he was uncomfortable, and you have a horse that's more stoic and doesn't show you any indications, because really the only indication I had was that he was uncomfortable. And a horse that's really stoic and would not show any indications, you wouldn't know that they were even colicking until it was really serious. So the fact that he's kind of a wimp about pain and told me that something was wrong, we were able to act quick and head it off so that it really didn't become serious. Somebody on the side of the road,
Golly,
door open.
Door open.
Oh, that's crazy. So, are there any questions yet?
Some Laura put emergency meds needed on hand.
Emergency meds needed on hand. Yes, absolutely. I've done a video a while back about everything that I keep in my medicine cabinet, and I have a lot. I have a really good working relationship with my vet, and he lets me keep a lot of medicines there that most people don't get to keep. And that way I can get him on the phone and he can tell me to give whatever is needed at the time. I've even had, he's even used me to kind of have other people come get medications from me for their horse. It's a real fine line there. As a trainer, I can't practice medicine. I can't, it's a huge liability to give any kind of medicine without the vet saying so. So I need to be able to consult with the vet. But on the other hand, having it on hand and being able to act quick is a huge benefit to the horse. So having that kind of relationship with my vet is a huge part of how I'm able to head off things like this so quick, so that they never become a problem. So I had Banamine on hand. I also keep some other stuff on hand, and that way I can give whatever he recommends, whatever he tells me to give.
What causes colic?
So what causes colic? So there's several different things that several different types of colic. We're confident was a gas colic. They can sand colic. They can have an impaction. Basically, colic is kind of generally any kind of abdominal pain. So that covers a real huge broad area of what can be colic. And colic can be caused from basically the horse getting constipated. They get dehydrated, get constipated, that'll cause colic. That's one of the more dangerous ones. I did check Woody. I pinched his skin and pulled it, and he was definitely not dehydrated. And that's a big thing. I am really big on, I do not like automatic waterers in my stalls. I want to have to fill that bucket so that I know how much water that horse drank. And when I went in and checked on him, that was the first thing I looked at, and he had drank a full bucket of water between about 8 o'clock in the morning and about I think that's around 1 or 2 in the afternoon, probably around 2, and which is pretty good water consumption. That's roughly 3 gallons and a half a day, so that's pretty good water consumption, and he wasn't dehydrated. But there's a lot of things that can cause colic. A wormy horse can colic. But colic is basically any abdominal pain, so there are a lot of causes for it, and gas is probably one of the more common ones, and a lot of things can cause gas. A change in diet, stress, it's possible that the fact that I rode when it was bad weather, that could have stressed him enough. You just don't ever really know. I mean, I rode, and he's the only one that had a problem with it. So you don't know. You really, a lot of times you never know what causes colic.
Okay. Do you have a video on trailering, traveling, and loading?
Do I have a video on trailering, travel, and loading? I have a loading video. It's actually one of my more popular videos. I approach loading a little bit different than what some people do. If I have a horse that don't want to load, in fact, I keep a trailer set up in a pen, and if the horse don't want to load, he gets fed in that trailer twice a day until he decides he wants to load. I really don't do a lot of physical work like lunging, like what you see some other trainers do to teach a horse to load. I pretty much just I'll make the trailer a good place to be, and if the trailer's a good place to be, then they want to be in it, and really I make it that simple. And a big cause of a horse that to not want to get in the trailer, if they're not scared of it, it's poor driving. Lots of lane changes, hard acceleration, hard stop, kind of throwing around in the trailer. So you need to you got to change your driving a little bit when you have a horse in the trailer. But I don't have a video on that. I'm not sure I have enough information to make a video. I'm pretty much going to say slow down. That covers, I mean, be sensible. I guess that probably would be a good video. Just hadn't thought about making that one. Any other questions?
A comment. Peter said he's sorry about all the negative complaints you received from his question the other day about the mounting block. He feels bad about that.
Oh, I don't feel bad about that. The negative comments are going to come. It doesn't matter. That's just part of being out there. I think most of the time when we get negative comments, it's people that don't even own a horse, maybe never even touched a horse, and have opinions that they don't really actually have any real life experience. So don't worry about that. Those kind of comments are going to happen. People, that's just how some people are. And so don't worry about that. And I really appreciate every one of y'all joining in for these lives and interacting, and please don't ever be afraid to make a comment. We try to monitor them as best we can, and that's one of the things. I do have the ability to ban people from the page, and when people start making comments negative, especially towards other viewers, that is the first thing that will get them banned. And but I like the comments, and really comments that really spur engagement and discussion are great for the channel. I like to have them. I appreciate you doing them, and it's good for the channel. So please keep commenting, and don't feel bad if somebody's making negative comments.
No questions.
No more questions? Okay. So LSU is roughly 2 hours, 2.5 hours, 2 hours and 45 minutes from me. It is right in the middle of Baton Rouge, which is one of the cities I hate driving through. Luckily, I don't have to cross the Mississippi River, so that's a plus. The next closest vet school to me is Auburn, which, as far as a vet school, I really like that one a little bit better, but that one's about 4 hours away. And when you're dealing with colic, where time is really important, where an hour can make a big difference, you want to get to the closest place you can get to. So for me, that's LSU Vet School. And the vet school is actually right next door to the football stadium, or right by the football stadium. And if you've never been there, you imagine the worst slum with the narrowest roads, and that's what's between LSU and the vet school. So it's kind of hairy and tricky to get in and out of. Anything else?
Not yet. You have comments,
Okay.
but no questions.
Okay.
Someone that lost their horse Monday to colic.
I'm sorry to hear about you losing your horse on Monday. Colic is tough, and it's some horses it's easier to catch early, like with Woody, and some horses you don't even realize they're colicking until it's too late, and it's just hard. A horse has, I think, somewhere around 45 feet of intestines that's basically only attached in two places. And if they colic and get those intestines twisted up, it's going to be bad. So that is a really bad situation, and it's hard to deal with. But if you have horses, at some point you're going to deal with it. That's part of owning horses. Not a good part, and that's why I wanted to talk about this in this video. You just don't. There's not a lot out there to help you be prepared, and I'd like you to be prepared, because a lot of times that's the difference between being able to save your horse and not. But sometimes, no matter how prepared you are, it's still not possible. Have a really good working relationship with your vet. If I had a vet that would not let me keep certain basic medications like Banamine on hand, I would look for another vet. And I know in some parts of the country, vets are a lot further away than others. In some parts of the country, you might not even have a vet that makes phone calls. Luckily, I do, and my vet is never more than an hour away. And also, I have more than one vet. I have two vets that I use, and that way, if for some reason I can't get one vet, I can get another vet. And it's two clinics, and out of those two clinics, it's three vets. So it's a resource that you need to keep on hand. And I know of a local vet around me that quite a few people use, but that vet will not leave any medication, and I will not use that vet for that reason.
Is the frequency of colic in horses in the wild any different?
Is the frequency of colic in horses in the wild any different? I really don't know the answer to that. I would think that horses in the wild probably do colic, but the thing about horses in the wild, it's basically survival of the fittest, and the ones that are prone to colic are not going to survive and reproduce, just like the ones with bad feet are not going to survive and reproduce. So I would imagine in a lot of those type of things in Mustangs and wild horses, that kind of stuff, I doubt that it's bred out, but it's probably bred down to be less of a problem. In our world with domesticated horses, we breed horses because of what they do and not because of whether they're prone to colic or not. It's not like somebody says, oh, this horse is colic twice, I'm not going to breed him. That just doesn't happen. So we breed horses that do colic, so I'm sure it happens more with domestic horses than it does horses in the wild.
You had someone that asked if you're hauling Woody to an equine hospital, and then someone else asked what's going on. Like they
just tuned in.
Yeah.
So what happened this past Monday? Woody colicked, and I've already brought him to an equine hospital. I brought him to LSU vet school, and he's doing okay, and we're actually on our way to pick him up and bring him back. And he colicked on Monday. Everything points to a gas colic. He recovered fine from it. No colic surgery or anything like that. Basically, he had sedation to relax his muscles, and with that, he passed the gas out. So that's what we're doing, and that's today's talk. We're kind of generally talking about colic, and we can talk about whatever subject y'all want to talk about. But since this came up with Woody, that's what I figured we would talk about. So I'm hauling a trailer. It's empty. We're on our way to get him. We're still probably hour and 45 minutes away from being there. I live on the Mississippi Gulf Coast. I live just west of Mobile, Alabama, and LSU vet school is in Baton Rouge. So we're driving to Baton Rouge right now. I think we're somewhere around Covington.
Okay. We are both beginners, but I was wondering your take on heaves and riding. Does it hurt his health to keep riding?
Okay, a question about heaves. That is really a good question. If you have a horse with heaves, is it good to keep riding? Basically, heaves to horses is very similar to asthma in people. They can't process the oxygen very well, so it takes a lot of effort just to breathe. So in the early stages of heaves, typically, if the horse can handle it, continuing to ride is good for the horse. Just like a person with asthma, exercise is good for the person. But you need to really stay on top of how bad the heaves are. You need medication on hand to treat them. There's a lot of medications for heaves that will help. A lot of times heaves is brought on by allergies, just like it is with people. So if you can maintain the allergies, that helps to maintain the heaves. But typically it does get to a point where the horse cannot be ridden anymore. It typically gets to a point where it's all the horse can do to breathe, and they'll reach a point where they'll even stop eating because it takes all their effort just to breathe. And at that point, you need to have the discussion with your vet to see if you've done everything you can do, and at that point that might be a time to discuss terminating the horse. But some horses will have heaves for a long time and you can manage it, and some horses it's a lot harder to manage. A lot of it has to do with what part of the country you're in. In my part of the country, down south with the heat, humidity, heaves is a lot harder to manage. But further north, where it's cooler and drier, is typically a lot easier.
Okay, you have a question from Angela, and also thank her because she did the super thing.
Oh, thank you, Angela. Thank you for the super chat.
Okay, and her question, since we were talking about GI issues, what are your thoughts on Ulcer Guard at weaning time? My filly will be weaning in August. Do they each need Ulcer Guard to prevent issues?
Okay, she's talking about weaning some horses and my thoughts on giving Ulcer Guard at weaning. Typically, when I'm weaning a baby, that baby is on a lot of pasture. And usually if your horse getting a lot of pasture, you don't typically have a problem with ulcers. Now, if your horse that you're weaning him and he's not on a lot of pasture, that would definitely be something to think about. It would be a possibility. Ulcer Guard's not going to hurt. I just don't know that it would be necessary. I would be trying to get just as much roughage in that horse as I can, because it's going to drop weight at weaning. They all do. And Ulcer Guard's not going to hurt, but I think I would do everything that I can as far as getting roughage into that colt, that baby, so that ulcers wouldn't be a problem, because you're gonna have to manage weight for the first month or two after they're weaned.
Ready?
Yeah.
You don't have to repeat it. I think they can
They can hear. Okay.
Yeah. So is it not true that Mustangs do not get colic because they are always moving and always nibbling, eating in small amounts?
So I honestly don't know if that's true or not true. I can't imagine them not colicking at some point, because in certain times of the year out west where they are, there's just not a lot of roughage, not a lot to eat, which is going to cause digestive issues. If they're not getting roughage in, then you just have the potential for problems. So I think they're less likely to colic, because the ones that are more likely just don't reproduce. But I can't imagine them not colicking. It's just too easy for it to happen, for it to not ever happen.
Okay. How does one find an internship with a ranch when you don't have many connections and below 18? Having a hard time in my state finding ways to gain experience. Outside of riding horses, I don't have experience in other fields.
So really the only way is to just go to a barn and hang out, clean stalls, anything that they will allow you to do. And that's the best way to get your foot in the door. You're not going to get an internship anywhere unless they know that you're willing to do the dirty work. And that's really the only way to do it. Just be there. And all of the kids that I have that hang out, that's how they got there. A lot of them came with their horse for help with their horse and never left. And that's how they got their foot in the door with me. People that just call me or message me about a job that I don't know anything about, I don't think I've ever hired anybody from that. Just go and hang out. That's the best way.
Someone said, just tuning in, what signs did you notice to know he was colicking?
Okay, the signs that Woody was colicking, basically he was just acting uncomfortable. He was in a stall. I had ridden him, rinsed him, put him back in the stall, and he was up and down, basically like that's basically what he was doing. But after he rolled, he wasn't stopping. He was just continually up and down. He really wasn't acting like he was in a lot of pain. He wasn't thrashing around, anything like that. He just went down to roll. It was a normal roll. We get back up, we can go right back down and roll again. So it was pretty subtle. And when I noticed that, he wasn't sweaty, his respirations weren't really up, his heart rate wasn't really up. It was just, I could just tell he was uncomfortable.
That's all the questions. So
Okay. Does anybody else have any other health issues you'd like to discuss while we're on this live and kind of talking that general area? Something that I would like to bring up, the question about the Ulcer Guard makes me think about it. I get a lot of horses that are shipped to me from northern parts of the country, and horses that do come in from up north, when they come into my heat in the summertime, ulcers can be a problem. So I do put them on Ulcer Guard, and I actually also have a stomach supplement that I put them on that comes from Eco Balance Solutions. That's what I had Denali on, and yeah, something that, and this Woody, now bring that up, Woody was on Legend, which is a digestive aid supplement, and to help prevent colic, and been still getting it. So there's a lot of things that can help, but nothing is a magic cure. If you remember, I had Trigger had ulcers, and I treated Denali for ulcers, and trying to think of another specific one. I can't think of another one specific, but I generally do treat them here and there for ulcers. Travis, he's being treated for ulcers right now. He's the one that was acting weird about the wall. So don't really know that that's a problem. I really don't think that's the problem, but we're giving it to him just to rule it out. He's one that has had ulcers in the past, so we'll go ahead and treat it, rule it out. I'm not a big fan of scoping them to check for ulcers. You got to do basically they got to not eat for a certain period of time so you can scope them, so you can see the ulcers. Well, by the time you do that, you're putting them in a position that makes them prone to ulcers. So usually I treat them, and just treat them. I do. You can use the Ulcer Guard that comes in the tubes. I have also bought omeprazole in bulk from Amazon and given it that way. It's a good bit cheaper that way. It's not really, it's kind of an off-label treatment. So I don't know that I really should say that I recommend it, but I have done that before, and I do think that works. A lot of it depends on if it's where the ulcers are in the intestine system. If they're more towards the rear of the stomach, into the intestines, I don't think that the omeprazole pills work as good, but I do think those pills work good when they're more stomach ulcers and not hindgut ulcers.
Okay. Before I ask this one says good info, but I'm also really enjoying watching the scenery as you drive. I'm in the Southwest and I'm only seeing brown landscape now. It's nice seeing the green.
Well,
okay.
Yeah, I am driving through Louisiana. I'm passing the Mandeville exit. So if you're not familiar with this area, it is green and kind of generally swampy. It would continue to get more swampy if we crossed the Mississippi River in Baton Rouge. But this is we're in the Pine Belt. This is where I live. This is what's normal to me. And it's pretty interesting, the different parts of the country. I've been out west where you're talking about, and I am amazed at how nothing there is. And kind of a note on that, it's been quite a few years ago, I had somebody send me a Mustang from, I think it come out of Arizona. I don't remember. This was a long time ago. And I was riding him at night after dark, and he had never seen shadows before. Where he came from, I guess there wasn't anything tall enough to make a shadow. So he was terrified of shadows. So that was kind of funny. Where he came from, there just was nothing to make a shadow, I guess.
Someone would like for you to talk about floating teeth in older horses. The newest use a machine instead of rasp. My mare's 23 years old.
Okay, so I will not hire a vet or dentist to float teeth that uses a rasp. They must use a power tool. And I really like the one on the drill motor with the little disc that spins around. My reasoning behind that is, and just kind of basic stuff, if I'm sanding on something and I'm sanding into a corner, I cannot sand that corner very good. And when you're falling on that horse's teeth and you're getting towards the back, I just cannot see how they're getting the back good with a rasp, with a file. And there's some negatives to using power tools too. If the person isn't good at it, they can really mess up some teeth too. I think the rasp is probably, or the file is less risk of the dentist doing harm, but I think if you have a good dentist, you get a better job. And you just think about that file going back and forth on the teeth. It's going to travel at least an inch or two or a couple of inches, and not as good as using a power tool like the one with the little disc that spins around. So I will not hire anybody to float teeth that does not use a power tool.
Do you recommend how owners ship their horses to you, like stopping often, hay, and water from where they come from?
No, I don't really have a specific recommendation, and to be honest about that, most owners worry way more about that than the horse that's being transported does. My experience is, as long as the horse gets to drink a couple times a day and gets some hay while he's traveling, you have very little trouble. And if an owner has a concept of their horse needs to be shipped with this routine, well, that routine, depending on whether the horse is shipped in a 6-horse slant trailer or an 18-wheeler box trailer, the routine is going to be different because of the trailer. And the stress on the horse is going to be different because of the trailer. So really, that kind of thing is better left to a quality shipper. And there are lots of really good shippers around that do a good job. And it's kind of like sending your horse to a trainer. You want to let the trainer do their job, and you send the horse to a shipper, let the shipper do their job. And there's shippers out there that are not good, but there are shippers out there that are good. Just shop around and find a good one. I get horses shipped in from all over the country, and I can't think of a single horse. Well, one horse got shipped to me in poor condition, but he was loaded on the trailer in poor condition. It was not the shipper's fault. So.
Do you feed alfalfa to young horses, and which form is better? I hear the hay is deadly with bugs.
So alfalfa, I believe that horses that are being worked need to get the nutrients in them to build the muscle because they're being worked. Exactly how you get the nutrients in them, whether it's alfalfa or something else, is not as important as that you give them the nutrients that they need. I have asthma, and I am very, very allergic to alfalfa. I cannot be around alfalfa hay, so I do not feed alfalfa hay, but I do feed alfalfa cubes because I can be around that. So that is how I like to get the nutrients in them, with a combination of the cubes and the feed that I use. I feed a pretty good quality feed, and then I feed a lot of grass hay. I do believe in feeding alfalfa. I hear a lot of people talk about alfalfa making horses hot, and I'm sure that can happen, but when they're being ridden regularly like they are in training with me, they need the calories. And as far as the bugs, yeah, the bugs can be bad, but you can feed grass hay with stuff in it that can be bad too. So it's not really fair to say that all alfalfa is bad because it can be bad. All grass hay can be bad because it can be bad. So you just gotta kind of, you gotta pay attention to what you're eating. You just can't say it's all good or it's all bad.
I don't know if you want to respond to this. I will only use a holistic dentist. Do you really want a Dremel tool on your teeth?
What does a holistic dentist do? I'm curious how that works. I mean, I believe in holistic treatment. Basically, holistic means treating the whole horse. And as far as a Dremel tool on a horse's teeth, yeah, if you've seen the inside of some of these horses' teeth, and what happens, a horse chews this way, like that, as they grind in the back. That's how the back teeth chew. But if the horse chews this, and they don't all overlap, then the way the mouth is structured, parts of the tooth aren't going to get worn down. Parts of the tooth will, parts of the tooth won't, and it don't get worn down, so you go in and make it even. And if you don't, you end up with those sharp points sticking into the side of the horse's mouth and causing pain and causing all kind of issues. So yeah, I believe horses' teeth have to be floated. I'm curious to what's different about a holistic dentist.
She says she sent you the link. Spencer's an amazing and has done a lot of study on the teeth, so she sent you a link about it.
I'll look it up. I just can't picture that in my mind.
Yeah. She said, the same person, I'm having trouble shipping horses from Southwest Colorado.
Having trouble shipping horses from Southwest Colorado. There is a shipper from, I believe, South Dakota that has brought horses to me several times. That's a good shipper. There's another one out of, I believe they're based out of Central Texas somewhere. Equine Express that has shipped horses to me. There's Magnolia Services out of Mobile, Alabama. It probably depends on what kind of route you are, where you are. I'm located on the I-10 corridor, so there are a lot of shippers that go up and down I-10 going to and from Florida. So it's a good possibility that I'm just in a good area that a lot of shippers travel through, and the area that you are, there might not be a lot of shippers. So that's probably what's going on there.
Laura says she don't know if you got her message, but Kaya would colic when he overheated once.
Oh, I don't remember seeing that message. Yeah, overheating would definitely cause colic for sure. Basically, any stress can cause colic. And so yeah, it's hard to believe that such a big animal that can do so much can be so delicate at the same time. And but they're tough and delicate at the same time.
Person said my vet had to float my baby's teeth when he was 7 months old because he choked 2 times. He uses the attachment to a drill. Yeah,
that's really unusual, a need to float one's teeth that young, but he could have had some kind of birth defect that required it. Typically, there are exceptions, but typically I don't worry too much about floating teeth until they start getting their adult teeth in. But if you have a young horse that has some deformities in how his mouth is formed, you would definitely need to get it done earlier. Just something to be aware of. There's all kind of possibilities.
The same person that was under 18 and looking to get an internship is asking, how do I go about training 2 horses that are not ridden very often when you lack experience in training horses?
I don't know that there's a good answer to that. Basically, all of the decisions that I make are based on experience, and whether I do this thing or that thing is based on my experience with horses. I would suggest that you work with somebody that has the experience to learn from them. That's what I did. When I was new with horses, I had somebody that I went to their place and got on everything they let me get on. And that's really the best way to learn.
Okay, James Rhodes. Tim, I transport horses around the nation, so I have a lot of listening time. I need you to make at least 3 videos a day so I have something to listen to all the time.
But James, it's kind of funny. Making the videos is easy. I mean, basically, I just record what I'm doing. I set a camera up and just record. It's the editing and uploading videos that's the hard part. So I really appreciate you watching and listening. And we'll put out all the videos we can. It's funny. When I first started, I was doing about 2 a week. but I wasn't getting up enough videos. I was getting the owners messaging me, "You got a video of my horse?" So then I brought that up to one a day, and now I'm probably somewhere around 9 or 10 a week. So trying to get up as many as I can. But the videoing part is easy. It's easy to set up a camera and video and talk. The hard part is the editing.
That's all the comments.
Okay.
I mean, there's comments, but no questions.
Right. So if there's nobody has any other questions, we'll continue on and pick up Woody. We'll go ahead and end the live. I'll pick him up. I'll get him back home, and we'll probably do another video of him, or do a video of him when I get back home, and just kind of talk about what he went through, because I'm sure a lot of people didn't get to watch the live. And we'll talk about, when I get there, the vet's going to tell me what his recovery over the next few days, week or two, what that is. I don't know yet. I would assume that's going to be a cut back on grain for a few days, probably some time off, but I'll find out exactly when I talk to the vet when I get there, and I'll post that. So I want to thank everybody for tuning in and watching. I wasn't sure how this was going to work driving, but it seemed like it worked okay. And until next time, thank you for watching.
I don't know. I forget how to change in the live on
In the
here.
X, I think, or something. Let's see.
Always in trouble with that. Okay.